Okay, so now we're going to start talking about some specific vocabulary words, if you will, that affect each different ultrasound unit and our treatments and the settings that we use and things like that. So the first one we're going to talk about is what we call the ERA, which is the effective radiating area. And this table from your book kind of breaks down some of these terms that we're going to talk about. So the ERA is the area of the transducer, so the sound head, that is producing the ultrasonic waves. And we measure it in centimeters squared, which makes sense, it's an area, right? So the actual ERA is usually significantly smaller than the contact area of the sound head. And this has to do with the fact that the crystal inside is not the same size as the sound head, and that the crystal is not uniform. And so we don't get a complete surface area that we're able to target. Okay, so larger ERAs produce a more focused beam than smaller ERAs do. So the ERA is directly going to affect the size of the area that we can treat. So if you look at this diagram over here, we have that the transducer head is a certain size, the crystal is a certain size, and then the actual ERA, the effective radiating area, that surface of the crystal that is actually producing enough wave and enough energy to produce significant sound waves, is smaller than that. So it's the surface of the applicator of the sound heads that's producing the sound waves. The ERA has to be labeled on every machine, so either within the like instruction manual or on the machine itself. Ideally on the machine itself should be labeled with the ERA. And it is not based on the sound head, though most machines will be matched that the sound head won't be significantly larger than the ERA, but the ERA is always going to be smaller than the sound head. And again, that's because no crystal is 100% effective. So ideally you want the ERA to match the sound head area as much as possible. And you want to also maintain the most effective contact with your skin in order to allow that ERA to be in contact with the treatment area that we want. Okay. So it's proportional to the transducer surface area that produces the ultrasound. And the way the manufacturers measure this is that it measures about 5 millimeters away from the face of the sound head, and how much energy are we producing and on what area of the sound head. So all areas that produce more than 5% of the max power output are considered within the ERA. So again, larger areas, you can get a little bit more of a collimated wave and beam. The smaller areas are going to be a little bit more divergent. Ultrasound is really only effective to treat small areas, so that's the big limitation of ultrasound. Okay, it does great things to get deeper into tissue than our superficial heating, but you should really only treat about 2 to 3 times the ERA. So if you only have a 5 centimeter squared ERA, then your treatment area should really be no greater than 10 to 15 centimeters squared. So some people will actually draw that out and map it and grid it so that they know that they stay within that. If you go larger than that, you're not going to effectively raise temperature or get enough energy to the tissue, because you're going to be constantly moving away from that tissue, and it's going to allow it to disperse, all that energy to disperse, so we never get up to the levels that will be therapeutic. Okay, so if you have to do an area that is larger than 2 to 3 times the ERA, you should either find a transducer that has a larger ERA, or you should do multiple treatments. So you would do one treatment in this 10 centimeter squared area, and then when that one's over, we would move and go to the next 10 centimeter squared area. You should not just increase the time, okay? Because of the way we move the sound head, we don't want to move the sound head all the way up into that 20 centimeter area, because again, that will allow the energy to disperse before you get back to the one part of the tissue. And so it's better just to do 2 separate treatments to target that area. Or we potentially use a different modality. We'll talk about diathermy as a way to heat deeply larger tissue, larger areas than ultrasound can.